Я відійду тоді. Шановні колеги, доброго дня. Дуже дякуємо вам, що ви вранці, практично в переддень Нового року, до нас прийшли. Це означає, що тема охорони здоров'я є надзвичайно важливою.
We gathered here to discuss important topics, and today we are planning to speak about national project, the list of key medicines and why we need it, and what kind of medicines will be provided for the patients, and why do we need such list of medicines, and what it means for the state and for customers. And today we gathered here Ulana Suprun, Acting Minister of Healthcare of Ukraine, Ilyk, Deputy Minister of Healthcare of Ukraine, Oleksandr, Chairman of the Expert Committee of the Selection and Use of Essential Medicines. And I would like to give the floor to Dr. Olena Suprun, and Ulana will tell us about the philosophy of the ministry in this case. Thank you. Good afternoon. Today we gathered here in order to discuss national list of key medicines. To provide quality medicines to Ukrainians, this is the priority for the Ministry of Healthcare. And these are key medicines that our patients need. This is the part of policy concerning medicines. There is ongoing work on this list, national list of medicines, and all state procurements will be done with the use of this list. And in transition period during next year, we will buy medicines through international organizations, and the patients will be provided with treatment. And then this list, national list, does not include those medicines that will be bought through international organizations and through the programs that will exist further. And the patients should get quality help, and the quality of their life should improve. We do not limit. We want to create a proper level of medicines that will be on this list. Our aim is to provide medicines that are in the national list to the patients, and in hospital all patients will get these medicines free of charge, and out of hospital patients will be included in a reimbursement program. And if needed, those medicines that are not on the national list will be bought with the use of state funds that will be saved after we buy these medicines for national list. We first buy those medicines that are on the list, and the rest of money we will use to buy medicines that are registered here in Ukraine. And we announce public discussion of the national list of medicines, the medicines that will be listed in this national list. And 30 days there will be public discussions, and we await for advice, recommendations, ideas about additional medicines or exclusion of some medicines of this list, and we cooperate with patient organizations that those medicines that are needed in Ukraine now can be in this national list. And we should understand that the national list of medicines, this is basic medicines that can be guaranteed 100%, that they are provided in hospitals, and they will be also included in the reimbursement program. We also support stability work of independent expert committee to realize one of the main elements of national policy in the sphere of medicines, the commission that works for 6 months that provides advice on this national list. And after discussions, when the first version of the national list is adopted, we will get applications from producers and the patients' organization, and we will add some medicines that were not included or exclude those medicines that are outdated. So you can apply, and during 2 years we will form this national list with proper economic feasibility, and to provide maximum amount of maximum number of people who really need this medicines. And I give the floor to Deputy Minister of Healthcare of Ukraine, Roman Ilyk, who for 6 months is working on the new national policy concerning medicines and on the national list of medicines.
Всім доброго дня.
Good morning, everybody. As you probably know, each ministry has to form the national policy, and our responsibility is to provide the population of Ukraine with the necessary medicines, and part of this policy is the national list of medicines, and this issue is part to the coalition agreement, and thus it is one of the top priorities in the operation of the government. So the major objectives in setting this national policy in terms of state provision of medicines is to ensure quality, cheap and really needed medicines to population. We have finalized the drafting of this policy. We have drafted the list of medicines. We have submitted it for public review, and for now we are preparing it for submission to the Cabinet of Ministers. In effective list of medicines, national list of medicines, currently there are more than 1,000 positions, while in our first draft we have 345 medicines. These are the most needed medicines which are not patented globally. 100 more medicines are those who are intended for treatment of specific diseases. They are contained in additional list of medicines. This is not final version of the document. Of course, the basic list of medicines would remain under continuous review. Out of that, 1,000 medicines which are comprised, which are components to the list of medicines effective today. They contain some components like animal oils, like shark body components, which do not contain any medical substance which is registered internationally. Thus, we cannot waste money for such compounds which do not have proved treatment effects. That is, our intention is to provide the most necessary, efficient, internationally recognized medical substances, treating substances, and to prevent any abuse in procurement. That is, we have to unify the doses and the prescriptions of that medicines. Of course, we understand that distributors and representatives of pharmaceutical companies would be interested to include their additional medicines to the national procurement list, while our objective is to use efficiently resources which we have. We have to guarantee by the state that in state hospitals and for outpatient hospitals prescribing medicines to vulnerable groups of population which are subject to reimbursement, we will 100% ensure a provision of those medicines, and I believe that finally we will reach this goal. Now I would like to give the floor to Oleksandr Oleschuk, Chairman of the Expert Committee on the Selection and Use of Essential Medicines, to answer the question how you are going to tackle the issues raised by patient organizations. Good morning, dear friends. Thank you for your interest shown to the topic of our today's discussion. As it was mentioned by the Minister and Deputy Minister, the national list of essential medicines is not just the list of efficient and important medicines, but this is the list of affordable medicines, affordable for the state, which could be guaranteed by the state. The expert committee, which is a permanent advisory board to the Ministry of Health Care, comprises 12 professional experts which were specifically trained in assessment of medical technologies, and the objective of this committee is to carry out comparative evaluation of efficiency, not just clinical efficiency, but also the cost efficiency of medicines, and to advise about inclusion of those medicines to the national list of essential medicines. We work on the basis of transparency, professional competencies, and openness for patient organizations principles. The major the first step was to define the list of top priority situations in which we should guarantee supply of the affordable medicines. First of all, the burden of disease. The second were social guarantees provided by the state. And here we paid attention at the social guarantees ensured by procurement via international organizations, and the social solidarity and orphan diseases, orphan diseases, and thus we have comprised our list. So the basic list of essential medicines was based on the 18th list of basic medicines suggested by World Healthcare Organization. Ukraine is not a unique country. More than 100 countries in the world uses this this list, and but for this time, for the first time in our history, we base our national list of essential medicines not just on the clinical indicators, but also on the medical technologies indicators. That is, we measure the affordability of those medicines for the state. That's why all the medicines were included to the list based on the following criteria: efficiency, safety, and economic affordability or cost affordability. During the entire period of our committee work, we have heard several questions raised by patient organizations. The first question was whether the national list would cut down or limit the access of patients to medicines. We believe that vice versa, this new list would increase access for patients to medicines. It will create the guaranteed list of medicines which are needed for the patients. What does it mean? It does not mean that all the healthcare facilities have to procure all the medicines in the list, but it means that they should prescribe these medicines if needed, based on the protocols approved by the ministry. As of now, the national list of medicines will be used for procurements for hospitals and for reimbursement to patients. But the basic idea, the principal idea, was to develop the unified list of medicines, which will be subject to public procurement for public money. Thus, within next 2 years, there will be national list of medicines and also the procurements in line with the national programs subject to funding from international organizations. Thus, the patients without interruption will get medicines subsidized by international organizations during the incoming 2 years. During these 2 years, the expert assessment of applications from healthcare facilities will be carried out, and after analysis, after review of these applications, we will purchase necessary medicines, and thus at the end of this process, we would finalize our list. The next question asked to ask why the national, while we have expelled from the national list some medicines which are in the basic list of WHO, because the national committee came to conclusion that without understanding of the impact of some medicines upon our budget, upon allocated budget, and not knowing the real price of these medicines, because they are represented in Ukrainian market by just one company, we decided not to include them upon submission from pharmaceutical companies and upon expert assessment of the cost efficiency of those medicines for our allocated budget, we will understand more clearly whether we can afford them or not. The procedure of our further work with applications from pharmaceutical company is also part of the national list of essential medicines. This document clearly sets the list of necessary documents which should be supplemented to the pharmaceutical company application. The expert committee has to review the application and supplementing documents, would analyze the data about efficiency of those medicines, and then based on that data, expert committee might submit to the healthcare ministry submission about inclusion of this or that medicine into the national list of essential medicines for this or that category of patients. This could be done once again upon submission of the committee. In the future, we plan to have the unified national list, and since 2019, we will have the unified list at the national and local level for hospitals, for clinics, and for everybody in the country. Thank you very much for your presentation. Now let's start our Q&A session. Please do not forget to mention your name and to mention to whom you address your questions. Please don't forget to ask questions on the topic, not generally.
Good afternoon, Olga Kupriyanova, Zdоровье Info. I have a question to Oleksandr Oleschuk. You said that medical institutions should not buy all the medicines from this list, but if a patient in hospital needs a medicine that wasn't bought by a hospital, what to do? Thank you for this question. I would like to say that we are speaking about those medicines that are on the national list and that are needed by hospital to treat patients. And there will be special methodology developed by the Ministry of Healthcare to identify the needs of medical institutions, and according to this, their work will be planned, and the patient will be provided with those medicines that are on the national list free of charge if they really need such medicines. Also, now I often sign redistribution of those medicines that were bought with the use of state funds to different oblasts. For example, in Lugansk and Donetsk oblasts, they don't need some cardiology equipment. But here in Kiev, we have a lot of institutions, Amosov, Shalimov institutes that need this equipment. So we redistribute medicines if there is need. The ministry addresses and we find where the medicines are needed, and those medicines that are bought at the local level, they will forecast what medicines they need, and if they need more, they should plan this. Next question from journalists in a Prestige Ukraine channel. Question to Ulana. And when will this list be introduced? When the patient will be able to address the hospital and get the needed medicine? At the moment, there will be 30 days of public discussions of the national list until the end of January. The Cabinet of Ministers will adopt this list, and then we will see how it will work. For you to understand, those that are on the national list, these are the medicines that should be guaranteed to the patients, and they should get these medicines free of charge in hospitals. And we buy a lot of medicines through state procurement, and we provide them to hospitals, and then we get information from the patient that they are forced to pay for these medicines, but we know that we provided these medicines to the hospital free of charge. And you can address the ministry through the site or using hotline. If someone asks to buy the medicines in February, those medicines that are on the national list, they should be provided for free. In case they are not provided for free, you can address the ministry, and we will deal with this issue. Oksana Seridazik channel. The ministry didn't buy the medicines. Phenylketonuria, the metabolic disease drugs for children who are less than 4 years. So there was some money allocated from the state for these medicines. Who was the initiator? Why it didn't happen? Why were they didn't carry out tender? This is not medicine. This is food we bought through one program, and only one producer submitted, applied for the stand-up. Several documents were lacking, so we cannot complete the standard if there is one participant, and it happened so that we didn't complete one of 9 programs, but now we work with organizations in order to buy additionally the medicines. This is not medicine, this is some sort of special food in order to provide to these patients. Good afternoon, Tatiana Kulesh. And Joe Orphan diseases in Ukraine. Phenylketonuria, this is special food that is not medicine. And we carried out preliminary consultations, and we thank you because we understand that this is a hard step. But for those who suffer from orphan diseases, this is important to get this medicine. And my question is like this. So this phenylketonuria and our patients, they need non-medical treatment, they need some special food. And how can we overcome these problems? And now we have the letter, and I ask everyone to spread this information, that everything that please address our organization. We have a lot of patients, and the problem is in medicines and medical equipment. I would like to answer. Now the expert committee, and this is the expert committee of selection of use of medicines, but the expert committee understands the prospects. And medical equipment, this is also medical technology. And in the world, the expert assess special equipment and technologies. And as you saw, we included orphan diseases. And we identified that we understand as experts the importance of provision of these medicines and equipment, and this is a serious prospect of further work and increase of the level of expert committee and its role. And we will buy special food and medical equipment through state procurement, through international organizations in 2 next years that are transition period. And also we would like to, we understand that the special food, this is not medicines, but some patients really need such special food. So we will have next press conference in several minutes. That's why maybe the last question. Question to Ulana. Yesterday, Prime Minister said that next year they will punish heavily those pharmaceutical networks that will increase the prices. Can a layman find this list and to verify the prices? And can the ministry verify whether the price is appropriate? So the reference price, it is done through special order, and reference price order is now coordinated with the Ministry of Economy, and after this order, after it is adopted, all the prices that were stated and identified, we have prices from reference countries, and there is formal thing. We will make it public at the site of the Ministry of Healthcare, and after all these procedures will be done, all the reference prices will be stated on the site of the Ministry of Healthcare. When we will undergo these technical procedures, and I hope it will be done tomorrow. And in drugstores, there will be information in drugstores about the price of these medicines. The reference prices will be stated. This is state service on medicines that will verify that the drugstores do not increase prices, and those who buy medicines, if they see that the price is elevated, so they should provide this information to our ministry or to the service on medicines. We cannot verify each drugstore in Ukraine. This is impossible. And we will ask the patients to address if they see that the drugstores, if they elevate the prices. But you should understand that there will be January, 1 month, when the drugstores will be able to sell the medicines that they bought with elevated price. That's why till 1st of February, we allow them to sell these medicines, what they have in stocks, and the new medicines that they buy and bring, they should be with the reduced price. Thank you for your attention. One more question from the patients of Ukraine. Good afternoon, Ina Boyka, patients of Ukraine. You said that from the 1st of January, the patient organizations also can initiate the submission of proposals to the national list. Can you tell us, please, what is the mechanism, what documents we as patient organizations can submit, because we are not producers. What are the requirements? Thank you for this question. I would like to state once again that first you apply to international non-patent name, then according to the normative documents that establish whether it is NGO or producer or applicant, all the applicants submit according to the regulations, the same regulations. And this is open information. This is the order of the Ministry of Health, and there is access to this information on the site of expert committee and the site of the ministry. Thank you very much for these questions. Thank the ministry for participation.